Hey everyone, and welcome back to UMCC Medical Consultant Connectors, the place where your health truly matters to us. It's great to have you here today. We're going to talk about a specific medication that many of you have asked about. It's called Griseofulvin. This isn't a new flashy drug, but it's a reliable one that has been used for a long time to fight certain types of infections. My goal today is to break it down for you in a simple, easy-to-understand way. We'll cover what it is, what it does, and all the important details you need to know to stay informed and safe. So, what exactly is Griseofulvin? Think of it as a fungus fighter. It's an antifungal medication. This means its job is to stop fungus from growing and spreading in your body. It doesn't work on every kind of fungus though. It's specifically designed to tackle a group of fungi called dermatophytes. These are the culprits behind many common skin, hair, and nail infections. You might know these infections by names like ringworm, athlete's foot, jock, itch. Griseofulvin is a prescription medication, which means you can only get it from your doctor. They will decide if it's the right choice for your specific situation. The main job of Griseofulvin is to treat fungal infections that are a bit more stubborn. Sometimes creams and lotions you put on your skin aren't enough. This is especially true if the infection is widespread, severe, has settled into your hair follicles or nails. For example, a ringworm infection on the scalp, known as tinea capitis, almost always requires an oral medication like Griseofulvin to clear it up completely. It gets to the source of the problem from the inside out, which is why it can be so effective for these tougher cases. Now let's talk about the dosage. How much Griseofulvin should you take? This is something your doctor will determine very carefully. The dose isn't the same for everyone. It depends on several factors: age, weight, severity, and location of the infection. For adults, a common starting dose might be 500 milligrams per day. It can be adjusted by your doctor. For children, the dose is calculated based on body weight. Follow your doctor's instructions exactly. Do not change the dose on your own. Taking too little may not clear the infection. Taking too much increases the risk of side effects. One key tip: take Griseofulvin with a high-fat meal. There's a scientific reason for this. Fat helps your body absorb the medicine more effectively. The fat acts like a carrier, moving the drug from your stomach into your bloodstream. Whole milk, cheese, ice cream, a meal with butter or oils. Taking it on an empty stomach can greatly reduce absorption. Consistency matters. Nail and scalp fungal infections can take a long time to clear. Scalp infection, 6 to 8 weeks. Fingernail infection, 4 to 6 months. Toenail infection, up to a year or more. Take the full course, even if you improve. Stopping early can let the fungus return, possibly worse. Recap: always take the prescribed dose. While Griseofulvin is effective, it's not the right choice for everyone. There are certain situations and medical conditions called contraindications. First and foremost, if you've had an allergic reaction to Griseofulvin or its ingredients, don't take it. Rash, hives, itching, swelling. It's also not for people with certain types of liver disease. The liver processes this medication. Existing liver problems could worsen. Your doctor will ask about your medical history. Porphyria is a rare genetic disorder affecting heme production. Griseofulvin can trigger a severe attack in porphyria, severe abdominal pain, nerve problems, mental changes. If you or a family member has porphyria, tell your doctor. This is critical. Now, pregnancy, a major contraindication. Do not take Griseofulvin during pregnancy. It can harm a developing fetus, including risk of birth defects. Women of childbearing age should use reliable non-hormonal birth control while taking it. Continue non-hormonal birth control for 1 month after stopping the medication. Men should wait 6 months after finishing treatment before trying to father a child. The drug may cause temporary changes in sperm. People with lupus should be cautious. Griseofulvin can worsen lupus or trigger flare-ups. Your doctor will weigh risks and may choose another antifungal. Like any medication, Griseofulvin can cause side effects. The good news is many people take it without major issues. It's important to know what you might experience. The most common side effects are often mild and can include things like headaches, nausea, and upset stomach. Some people might also experience a skin rash, dizziness, trouble sleeping. Often these side effects can lessen or go away as your body gets used to the medication. If you experience these, talk to your doctor, but they may not be a reason to stop unless severe or really bothering you. There are some less common but more serious side effects to be aware of. One is increased sensitivity to the sun. Photosensitivity. Your skin may burn much more easily than usual. Wear protective clothing, use a broad-spectrum sunscreen with a high SPF, avoid prolonged sun exposure, avoid tanning beds. In rare cases, more serious side effects can occur, such as severe skin reactions, liver problems, changes in your blood cell counts. yellowing of your skin or eyes, unusually dark urine, severe fatigue, a persistent fever or sore throat, contact your doctor immediately. So how does this medicine actually work inside your body? This part is pretty cool. Griseofulvin gets absorbed into your bloodstream and then deposits itself into the newly forming cells of your skin. It's also really important to talk about drug interactions. One of the most significant interactions is with hormonal birth control, like the pill. Griseofulvin can make oral contraceptives less effective, which increases the risk of an unplanned pregnancy. This is why it's so strongly recommended to use a second non-hormonal method of birth control like condoms, while you are taking this medication, and for a month after you stop. Another important interaction is with blood thinners such as warfarin. Griseofulvin can decrease the effectiveness of warfarin, which could increase your risk of forming a blood clot. If you are taking a blood thinner, your doctor will need to monitor your blood very closely. Alcohol is also something to be cautious with. Drinking alcohol while taking Griseofulvin can, in some people, cause a reaction that includes a fast heartbeat, flushing, and a general feeling of being unwell. Always, and I mean always, give your doctor and pharmacist a complete list of everything you are taking. Prescription drugs, over-the-counter medicines, vitamins, herbal supplements. Being transparent about everything you take allows your healthcare team to check for any potential interactions and keep you safe. And that brings us to the end of our discussion on Griseofulvin. I hope this breakdown has helped you understand this medication a little better and empowers you to have more informed conversations with your doctor. Thank you so much for joining us today at UMCC Medical Consultant Connectors. If you found this information helpful, please hit that like button, subscribe to our channel for more content, and share this with someone who might need it.